Are you effectively managing moisture to reduce incontinence-associated dermatitis, also referred to as IAD? Let's begin with the definition of incontinence-associated dermatitis, or IAD. It is defined as skin inflammation manifested as redness, with or without blistering, erosion, or loss of skin barrier function that occurs as a consequence of chronic or repeated exposure of the skin to urine or feces. IAD is a common, painful problem for many. As the focus on pain management continues to be a priority across the continuum of healthcare, it is important to prevent and treat IAD to reduce pain for each resident and maintain their skin integrity. IAD is not gender, race, or age specific. It affects individuals in ICUs, hospitals, long-term care facilities, and even individuals living within the community. This increases the amount of time healthcare professionals must care for each person with IAD. It is not only the delivery of direct care, but the time needed for creating and implementing plans to manage an individual affected by IAD and the documentation. This can result in as much as 34 minutes per patient day. As you know, there is bacteria on the skin. However, intact skin prevents bacteria from entering the body. Bacterial growth is also inhibited via the skin's acid mantle. And as you may recall, the normal acid mantle of healthy skin has a pH of 4 to 6.8. When skin breakdown occurs as a result of IAD, the bacteria and potential fungus that is present on the skin surface can enter the body. Pain associated with IAD can be displayed as a resident complaining of burning, itching, and/or tingling of the skin. IAD can affect a resident's quality of life through loss of independence and disruption of activities and sleep as the frequency and severity of the incontinence progresses. Recent studies show a direct correlation between pain intensity and the degree of skin damage associated with incontinence. IAD can also contribute to the development of pressure injuries because excessive moisture reduces the skin's tolerance to excessive pressure. Let's look at some statistics regarding pressure injuries. On an annual basis, more than 2.5 million individuals develop pressure injuries, and 60,000 people die as a direct result of them. $20,000 to $150,000 can be spent caring for an individual that develops a pressure injury, and $9 to $11 billion is spent to treat pressure injuries in the U.S. And this is not even considering the ramifications and cost of litigation. With these facts in mind, know there are skin products that can assist in the management of incontinence, IAD, and factors that contribute to pressure injuries such as shear, friction, and moisture. Clinical characteristics of IAD can be blanchable erythema, glistening of the skin, partial thickness skin loss, and vesicles containing clear exudate. The severity of skin damage can be related to age because of lower baseline function and prolonged healing capabilities. The duration and frequency of irritant exposure and the type of irritant can also impact the severity of skin damage. Incontinence involving a combination of both urine and feces can be 50 to 70% more irritating to the skin than urine or fecal incontinence alone. Moisture management products can be the solution to incontinence-associated dermatitis. Traditionally, incontinence was managed with reusable linen products and standard underpads or chucks. However, reusable linens tend to struggle to lock in moisture and prevent fluid from touching the skin. They may leak and thus are unable to contain moisture. Standard underpads may tear. They do not wick away moisture, and care providers frequently layer multiple products. Remember that these products lack air permeability. Did you know that moving a patient or resident with a reusable underpad is technically off-label use? There is nothing in writing that says reusable underpads are approved for repositioning. Does this put your facility and staff at risk? The use of premium underpads, however, allows fluid to be quickly wicked away and locked into the super absorbent dual inner core with super absorbent polymer. This also neutralizes pH and unpleasant odors. The moisture vapor permeable film allows moisture to transfer away from the skin while protecting bed linens, keeping the skin dry and the resident comfortable. The features of the premium pad provide a healthy environment for skin. Premium underpads are approved for repositioning. The durability of the material on the back sheet of the premium pad assists in lifting and repositioning individuals up to 400 pounds and can reduce or eliminate the use of draw sheets and reusable linen underpads, which can wrinkle or bunch under the resident and contribute to the development of pressure injuries. In addition, only one premium underpad is needed under a resident at a time. To sum it up, one layer keeps linens dry, patients dry, and is strong enough to reposition and easier to manage, reducing bunching, bumps, and ridges, thus lowering the risk of pressure injury. Premium underpads provide maximum absorbency and vary in the lifting and repositioning capabilities from 300 to 400 pounds. The variety and product selection allows the customer to purchase what is best suited for the overall incontinence level and needs within their facility. Premium underpads have additional features outside of repositioning capabilities, breathability, and maximum absorbency. The premium underpad is designed with a soft top sheet to provide resident comfort and reduce shear and friction, two factors which contribute to the development of pressure injuries. And with breathable back sheet technology to facilitate airflow to keep skin dry, which helps create an optimal microclimate. As you can see, premium underpads are available in a wide variety of absorbency levels and repositioning capabilities, allowing for the appropriate pad for each resident. There are solutions to fit your needs and your resident population. The review of a case study comparing the use of reusable underpads to premium underpads provides results showing a reduction in incontinence-associated dermatitis severity scores and a lower percentage of patients with IAD when they were placed on disposable versus reusable underpads. Facilities have seen great improvement in resident skin health through the implementation of premium underpads in everyday incontinence care. In conclusion, properly managing moisture with the residents is crucial in not only maintaining the integrity of their skin, but also protecting the reputation and rating of your facility. Poor resident skin health can lead to lower 5-star ratings, pressure injuries, and possibly higher admission rates. Proper product selection and usage for optimal clinical outcomes is more important than ever with the new regulations and value-based purchasing. For further education, please visit the Cardinal Health website.